Hi there, my name is Mora Onyonka, and I'm a corporate development manager within Silicon Valley Bank, and I sit on the Access to Innovation team. And I'm located here in the heart of Bed-Stuy, my favorite of all favoritist of neighborhoods within Brooklyn. So welcome. I just want to say that on behalf of Silicon Valley Bank, we are so proud to sponsor Startup Grind and the SG's Women's Summit this year to join in celebrating and empowering women entrepreneurs and investors. Through our initiative, Access to Innovation, we are always working to advance women, Black, and Latinx individuals to positions of power and influence within the innovation economy. And we're able to do this through many different ways, like increasing the pipeline of diverse, talent to our clients with powerful partnerships, connecting diverse groups to SVB's vast network within the innovation economy. And 3, unlock greater access to capital, professional relationships, and career opportunities that underrepresented minority groups may not have historically had. We are always aiming to be that source and that catalyst for good within this sector. And we understand that it is because of diverse perspectives, inclusive environments that really aim to ignite beautiful, big, bold, audacious ideas. And so we invite you to learn more about Silicon Valley Bank and about our Access to Innovation program and initiative by visiting www.svb.com/access. Thank you again and welcome.
I know you're at a exec offsite, and it looks like you're backstage on Broadway or something. So thank you for taking time to talk to us and the entire group at Startup Grind. I feel so passionately about healthcare and in particular sort of women's health, especially in these times. And I'd love to talk a little bit about TIA and what prompted you to start the company.
Well, Alda, it's so nice to see you and to Startup Grind team. Thank you for having me here. Really excited to be here and share more about the TIA story, which I think, as you alluded to, Alda, I think is particularly pertinent and resonant amongst this, I think, critical crossroads that we're facing in terms of the future of women's health and women's rights and so forth, which is a deep driver for me as a female founder of a mission-driven business. To start, to give you, I guess, a little context about how I started TIA and what our mission is. Started the company about 5 years ago, very much as a patient turned entrepreneur, frustrated by a healthcare system that is not serving women, and thought there had to be a better way. Went through a long diagnosis process in my early 20s and experienced sort of the brunt of 3 problems that we seek to solve at TIA. The first is fragmentation. So the fact that the healthcare system is deeply fragmented for men and women, but especially for women who have more frequent and complex needs. And it's fragmented by body part or in reproductive life stage. So there's all these different doctors or CPT codes for you go to for different body parts or ailments or different sort of narrow reproductive life events, whether it's I think particularly pertinent to the conversation of this current time. It's, you're either avoiding pregnancy, you're pregnant, or you're not, you're postpartum. And that's it. And we kind of don't really think about what would healthcare look like before 50% of the population as whole people, not parts, who controls more than 80% of the dollars. So that's kind of the first piece of it. The second is the healthcare system is, all too focused on treating sickness with a lack of attention or care really at all for prevention. And women who have problems with that and the way women are misdiagnosed, gaslit, mistreated by a healthcare system that doesn't care about prevention, doesn't sufficiently understand sex-specific difference and so forth. And then the third piece that we're really focused on at TIA is the all too sort of transactional way that the healthcare system, I think, lacks soul relationship sort of humanity. And you think about, again, the current landscape and the emotional potency in many ways of so many women's healthcare journeys. And we really aspire to create a model that's all about relationships, that's affirming of women's choices as whole people, and that puts them in the driver's seat when it comes to their health. And so that's a little bit of what drove me to start TIA and create what we are today, which is fundamentally new paradigm for modern women's healthcare, one that aims to defragment women's care, to create a model that's about whole people, not parts, that is relationship driven and focused on prevention.
And you and I met almost 4 years ago now, and I think TIA and what it's become today was just a glimmer in your eye. And I've been so impressed how everything has come together. And I know you just launched a clinic in San Francisco in my backyard. Can you talk a little bit about your journey and how you got to where we are today, which is, I think, really, really just amazing given the environment and the actual work required in building physical clinics?
Yeah, it has been a journey for sure to get to where we are. A windy road in many ways, but I'm really proud to be a trailblazer, I think, in the category. I often say there was like a kind of three things working against me, being a female founder, being a founder and a first-time founder in healthcare, and with healthcare. Three of those things together, and it's like screams risk to many investors. And we've, I think, overcome those barriers and are proud to be one of the most well-financed players in the category, I think, with a real opportunity to create systems level change. I want to talk a little bit about how we did that. And one of the big things I would say, in addition to building the care model, building sort of the operational machine to deliver care virtually and in person and partner with health systems and navigate insurance and all the complexities that go into our business, is kind of this broader goal about changing the sort of mental model, the historical mental model in the industry, both amongst investors, but also traditional buyers of healthcare, payers, providers, employers, that women's health is quote unquote niche. And when I started the company 5 years ago, people used to say to me, why would I invest in a company that cuts out half the population? Isn't that cutting the TAM in half? Why would I buy a solution for just women when I can buy a solution that serves women and men? And I think over the last 5 years, we've seen a kind of tectonic shift amongst investors and those buyers of healthcare, that women's health is not niche, but women are the most powerful yet underserved customer in healthcare. And what we're doing is building a personalized care delivery model for the most powerful customer who controls more than 80% of the US healthcare dollars. And as a result, today, when I meet with investors or CFOs of hospital systems, like at UCSF, where we just announced a mega partnership to open 10 clinics that will serve 40,000 women in the Bay Area, there's this kind of recognition that women's health is not just, so there's not just a moral imperative, but an economic one too. And I think it's so critically important that we think about women's health, reproductive rights, women's rights through a moral lens and an economic one. And when we can show that investing in women's health is not just good for women, but good for business, that when women are healthier and have better care, their families, their communities get access to better care, everyone wins. That's really what I think TIA is, has started to show. And we're seeing a kind of a broader shift in the industry's approach to women's health as a result.
And as far as the investor community, and you've had a great deal of success raising capital, has there been a shift in the mindset from, and I know that, the Series A was raised predominantly with a lot of female investors. But as you've gone sort of later into growth cycle of fundraising, has there been a shift in the mindset of male VCs?
I do think there has been a shift. And we're really proud to have both men and women who, on our cap table, but also have a company that looks different. We are of 100% female board of directors. Both our Series A and Series B were led by female investors. We have a 100% female leadership team, and the company is 75% women. So we don't look like a typical company. And that's just on the sort of, when you talk about, gender, and we also really focused on other aspects of diversity on our cap table and on our board and leadership team and company more broadly, and believe that it's important that your company mirrors who you aim to serve, and that there's a competitive differentiation in that. And I like to say we've been able to get amazing healthcare investors first, who happen to be women, who are able to pair like smart business with their personal lived experience, I often talk about, and bring that to benefit the company and that moral and economic imperative. But convincing the traditional with all that, I think, getting men on board has been a journey, and one that I think we're, seen a lot of progress with men who understand that women's health is, as they say, not a her problem, but an our problem, or from an investor perspective, an our opportunity. CFOs of hospital systems often describe the TIA patient as the chief medical officer of her family or her household. Women not only spend more dollars on their own healthcare, but tend to make the bulk of the healthcare decisions and spend the dollars on behalf of their children, partners, and parents. Yet, 50% of women don't trust the US healthcare system. And so I often say the healthcare system has a loyalty crisis with its most powerful customer. And what TIA's opportunity is to rebuild trust with this underserved, very cynical and disgruntled customer for good reason. Give them better care, bring them back in the fold of the healthcare system. And by doing so, make healthcare work better for women, for families, for communities, and build a strong business at the same time.
Absolutely. And, as far as your team and your board, it sounds like it wasn't just sort of a coincidence, but that there was some intentionality. And you've talked publicly about how you've architected who you have around the table advising you. And I'd like to talk a little bit about how you've been able to really get such a fantastic group of executives and board members and investors, and how to accomplish that for other companies that want the same.
Yeah, I think we've taken a different approach in terms of who we prioritized, from building an amazing leadership team and investor set and board members at different stages of the company, building a full stack care delivery model like TIA and scaling it is a very complex business. We are a direct to consumer brand. We are a technology platform. We are a clinical services business, and we sell to health systems. So there's a lot of different types of, it's a B2C to B model, and a lot of different types of investors and experiences we need to be able to crack all aspects of that. And so, I'm really excited that our board consists of sort of a diversity of perspectives. We have our investors who led our Series B at Lone Pine Capital have a lot of experience, actually more in sort of consumer retail and scaling omnichannel businesses with both virtual and in-person aspects. It can really help us thinking about that aspect of our business. Emily Melton at Threshold, who led our Series A, has a lot of experience both in consumer and in healthcare services, as does Lynn Chow O'Keefe, who's on our board from Divine Ventures, really understands the payer and the health system part of our business. Most recently, we brought on our first independent board member. Her name is Dr. Adeze Enekwechi, who is a partner at Welsh Carson and led healthcare policy under President Obama and many, many other amazing things, bridging the public and private sectors. And we really brought her on our board to pair that diversity of business experience with lived experience as a woman of color, as a woman who's played a big role in maternity policy and health equity and diversity, equity, and inclusion from a healthcare policy perspective, and help us think about how TIA builds a model that is not just higher quality, but lower cost and can scale to serve all women and achieve our health equity goals at scale. And so bringing all those amazing perspectives together, I am lucky to say I enjoy our board meetings. It's like an intellectual kind of dream in many ways to be able to pair these different perspectives around the table to help guide me and my co-founder Phyllis and our leadership team to build a really differentiated company.
I'd like to shift a little bit and talk about this Roe versus Wade leaked opinion, and it really has set me thinking, as a former lawyer myself, a lot about the implications of what it has for women and for our economy in general. Would love your thoughts.
Yeah, it's been a very a whirlwind couple of weeks, and one that is extremely upsetting. I think just as a woman in the world, and of course as kind of with my CEO founder of a women's healthcare company, that hat on as well. And I think, I published a letter about what T has done, and I'll kind of walk you through that in a moment. And that kind of, I think, highlighted maybe a different perspective than some others had in this space, which was, while this is extremely upsetting, it's not surprising. And I say that from a lens of taking a pragmatic approach, which is, I think, so critical that anyone who cares about women's health, cares about the future of women's empowerment, women's rights in this country needs to really deeply think about, is that, Roe v. Wade has been challenged for the last 50 years. It's been a slow chipping away of women's reproductive rights. We operate in certain states like Arizona that have many, many restrictive laws on both patients and providers, waiting periods, all these sorts of trap laws, they're called, that have been slowly eroding access. TIA as a company and as a board really saw, I think, the tea leaves. And last fall, when Dobbs versus Jackson went to the Supreme Court and said, really think this is going to be the final straw, and we need to be prepared. We need to be prepared for a post-Roe America, and instead of taking how do we save Roe and go backwards, how do we go forwards? And that's really the approach that we've been taking. For us, I think the centricity of reproductive rights, reproductive health to our vision, to our care model, has been inextricably core since the beginning. There's on the one hand, I think our strategy as a healthcare system and from a socio-political perspective has been flawed and has failed women. We've spent the last 50 years reducing women's health to a singular issue, a body part, abortion, and that hasn't served women. And here we are. I think in starting TIA, in many ways, part of my vision has been, how do we build a new model of healthcare that is inclusive of, but not limited to, reproductive health? How do we think about mental health as women's health? How do we think of as cardiovascular disease, the number one killer of women, as women's health? How do we think of, postpartum care as women's health? Women's health is not a body part or a life stage. It's care for 50% of the population. And so when I think about the go forward strategy for a post-Roe America, I think, how do we take a strong stance and walk the talk, which is what TIA is doing, and expanding access and providing abortion services ourselves, specifically medication abortion through our virtual care platform in states in which it's legal to do so, which it today includes California and New York. And that is the stance that we've taken as an organization, and just rolled out these services to our members in those states, and are very proud to be doing that, and taking a stance that abortion is core, abortion is healthcare, full stop, period. But also saying abortion isn't the full story, and we need to deliver comprehensive women's healthcare, and that's what women need and deserve. And so that's a little bit about the approach that TIA is taking and the journey we've been on, and believe that we need a new platform, a new model that is inclusive of, but not limited to, abortion, and finds new ways to give access to these services in what is going to be a highly restrictive world of even more polarized to America's, that severely limits women's rights in certain states.
And you talked about Arizona and how there's a lot of regulation to limit that right. How is TIA planning on operating there, and indeed in other states that are even more restrictive?
I think it's too soon to tell what's going to happen on a state by state basis, and we're in a bit of a waiting period. And I do think this is an opportunity for both from a particularly talk a lot about companies, corporate America standing up as abortion as healthcare as an employer issue. Because healthcare is tied to employment in this country, we can debate whether that's a good or bad thing, but that is where we're at for the vast majority of people. Women's health is an employer issue and abortion is an employer issue. And so we need to be thinking about how employers need to be thinking about how they're going to give access to healthcare services in a world where it may look like a more restrictive or polarized America with different levels of access and legality in different states. But what we really don't yet know is, well, the world's going to be more restrictive. We don't know how restrictive, for example, on with the federal protection removed, if Roe is in fact overturned, it will fall to the states, and states will have an opportunity to either pass protective legislation, which is what states like California and New York have already done, or more restrictive regulation, which may vary from state to state. And so for us, I think with all those unknowns, we don't know what it's going to look like in Arizona. But what we do know is that women everywhere need primary care. Women everywhere need mental health care services. And women who live in restrictive states are likely going to have to travel to more progressive states to get access to services, which will then create I call it a spillover domino effect, where women everywhere are going to have access issues, even more access issues, I should say, than they do today. And so our approach is saying, how do we deliver our core product everywhere and making sure that we can do so, ensure that we can, women in states that are more restrictive have care support and navigation to navigate a complex and highly regulated world, that we can partner, take a global local approach and partner with organizations on the ground who are providing these services, which is what we do today in Arizona, and have a deep partnership with a local abortion provider on the ground. We provide their patients primary care, and they provide our patients with access to these services, and navigate figure out how we navigate this new world by expanding access in places where we're able to do so, which we believe will sort of increase the global supply and help mitigate the sort of this massive access gap that is likely to ensue following the final ruling.
And, you know, other than voting, obviously, what can TIA do? What can we do? Should we be talking to our employers? How are you thinking about, mobilizing a group of people who have been fragmented, as you said, and in many different ways?
I think there's really kind of a couple of different tracks or pathways that I think different individuals and companies can take. I think first, if you're an employee at wherever you may work, I think it's a great time to talk to your benefits manager, your HR team, and say, hey, what are my rights? What are my benefits? Am I living in a state that is likely to be restrictive? Or am I living in a progressive state that is going to protect my access? And what are we going to do for other employees who may not have the same rights as me? And push your leadership to take a stance that abortion is healthcare. There have been excited to see certain companies like Yelp and others really step up and take bold stances. And we need more leaders to do so. I think for healthcare companies like TIA, whether you're a women's healthcare company, a general primary care player, or a virtual care player, you can provide the service. Yes, there are restrictions in certain states that we need to all navigate, but the more providers that step up and start providing abortion as healthcare, as primary care safely and legally, the more we're going to normalize it and contribute to filling in those access gaps. And I'd really like to see more healthcare leaders step up and normalize abortion as part of healthcare, not a siloed service.
Carolyn, thank you so much for letting me be an investor in TIA and for fighting this fight on behalf of all women, and spreading the word that women's health is everyone's health. And I really appreciate it and hope that we can continue this conversation.
Thanks so much for having me.